Surgical patients will need to have their incisions monitored as well. Healing incisions often are an irresistible licking temptation to many dogs and cats. Animals exhibiting this tendency should have an Elizabethan collar or bandage in place, making chewing a near impossibility. The post-surgical incision should be evaluated often for evidence of infection or missing sutures. Infections are often denoted by red, tender, swollen skin, or the presence of a purulent or pussy discharge from the incision. As with the other nursing responsibilities we've just discussed, thorough documentation should accompany these inspections. One of the most significant post-surgical complications we would like to prevent is that of a surgical dehiscence. A surgical dehiscence occurs when sutures are removed or chewed out prior to adequate healing of an incision. Dehiscence of an abdominal incision may lead to the contamination and exposure of the abdominal organs. This is a very severe or even life-threatening complication that can often be prevented with careful observation and the implementation of steps to prevent chewing at an incision. As previously discussed, an Elizabethan collar or bandage works quite well at preventing such complications. Another complication is the formation of a seroma. A seroma is a pocket of fluid that forms under the skin near the incision. This fluid is usually not infectious but results from an inflammatory reaction secondary to the surgery. A hematoma is similar to a seroma except that the pocket is filled with blood. Identifying a seroma or hematoma often requires palpating the area around an incision. If any abnormalities are noted, the veterinarian should be notified. Remember also that when moving a surgical patient, they will likely be quite sore for several days after the surgery, sometimes even much longer. Move them carefully, taking precautions not to get bit. Many veterinarians will prescribe pain medications to patients after surgery for the patient's comfort. Pain control patches are also sometimes used after a painful surgery. Getting the post-surgical and recovering patient back on their feet is an important part of the recovery process. Exercise is helpful in improving circulation, minimizing scarring, and maintaining joint function. The time necessary for a recovering patient to begin walking is unique to each individual patient. Always consult with a veterinarian prior to initiating any exercise. At the appropriate time, getting outside and walking in the fresh air can be quite invigorating to a dog and will speed their recovery. A chance to relieve the bladder and bowels also serves an obvious purpose. A hospitalized patient may be carefully walked on a leash even if IV fluids are attached. It may be best with some patients to cap off the catheter with a male plug and flush the catheter with a heparin solution prior to the walk. A loose covering with vet wrap and the patient will be free of the restrictions of the fluid bag and its tubing. Pets that are not able to exercise or even rise have other needs that you will likely need to attend to. Pets that are unable to rise are considered to be recumbent. Primarily, there is the need to rotate which side these patients are lying on. Rotating them every few hours and being sure they have sufficient clean and dry padding to lie on will reduce the chances of producing bed sores, also called decubital ulcers. A fleece or synthetic sheepskin works well to prevent the formation of these bed sores. Their ability to escape their own urine and feces creates the need for additional nursing and hygienic care, as discussed earlier. Preventing these sores and superficial infections is much better than trying to treat them once they've begun. The nutritional needs of healing animals varies greatly. Though the daily demand for calories is often significantly increased in the healing phase, there are situations that alter the type and amount of food some patients can eat. Many medical conditions have special diets that have been designed specifically for optimal recovery. Your understanding of these diets is the focus of other programs. Your veterinarian will recommend the diet of choice for each recovering patient. You should also inquire as to the amount the patient should be offered. There are some conditions that are best treated by withholding food and water altogether. If feeding is the responsibility of someone else on the staff, be sure and communicate accurate feeding instructions to them. This is sometimes done with cage markers so as not to make a mistake. An animal's eating habits are quite significant when making medical decisions with hospitalized patients. It is therefore very important to communicate this information with the attending veterinarian and write it down in the medical record. Very debilitated animals may require a feeding tube in order to gain sufficient nutrition. High-calorie liquid and soft diets can be syringed through these tubes, providing the pet with the energy necessary for adequate healing. These tubes must be kept clean and flushed, as they may be kept in place for an extended period of time. Two of the common high-calorie diets commonly used in tube feeding are Hill's AD and Purina's CNM formula. Other patients may be receiving supplemental oxygen. This may take the form of a nasal oxygen tube or an oxygen cage. Both provide the patient a higher concentration of oxygen than the 20% oxygen existing in room air. Oxygen flow is regulated to adjust the final desired concentration, usually somewhere between 30 and 40% oxygen. A humidifier is sometimes used to keep the airways moist. Avoid repeated opening of the cage door to minimize oxygen loss. Special care must be exercised when working around oxygen, as there is a potential for explosions. Be sure there is an adequate supply of oxygen in the cylinders when a hospitalized patient is receiving oxygen. And finally, remember that animals heal faster when they receive affection. Regular daily attention and verbal communication must certainly boost their morale and speed their recovery. It also does wonders for you, as it reminds you why you're working in a veterinary hospital in the first place. The pet's owner will be especially excited to hear that you've given their dear pet some of the same love they would have given. Everyone benefits from giving affection and attention to the hospitalized pet.